Well, hello and welcome to part 2 of Late-Onset Gender Dysphoria from the book Transgender Ideology and Gender Dysphoria, A Catholic Response. Section 9.4 was so long, I've turned it into 2 sections, so the second part is a bit shorter than the first one. Go ahead and click the first part if you haven't seen it yet. If you want to follow along in the book that this is associated with, there's a link below in the description. I guess let's jump into it. So then one of the questions is, what do parents do? So some doctors publicly state puberty blockers buy time until the adolescent is cognitively mature enough to decide whether to acquiesce to the puberty concordant with their natal sex or to proceed with cross-sex hormonal therapy that will bring their identities more in line with their bodies. Right? This is a common approach, right? Puberty blockers with this idea that it will give time for the young person to figure it out. Well, we can look at this in 2 ways. One is, will the young person mature, right? Will they come to psychological maturity with time? Well, that's true, right? If somebody's going to make a lifelong medical decision, it's better that they are 18 than 12, right? There's a big difference in terms of cognitive ability to foresee the future and having prudence and the proper foresight to make a lifelong decision when you're 18 versus 12, which is why we let 18-year-olds get tattoos and not 12-year-olds. 18-year-olds can join the military, not 12-year-olds. 18-year-olds can smoke, not 12-year-olds. 18-year-olds can drive, not 12-year-olds. Right? So part of that is true, right? Cognitive ability catches up. Will the dysphoria naturally, will it go away? Will the dysphoria go away? That's another positive part, right? The dysphoria may go away with time, right? The statistics show that more likely than not, it would go away with time if this is gender dysphoria, but it might not. Will the time cause it to go away? Not really, right? As the example I gave before, it's like putting the dough in the oven and not turning on the oven, right? To think that the bread will bake, it's not going to bake with time. It requires heat, right? So if you take puberty blockers, you're not going to sexually mature psychologically or physically, right? Because it affects the brain. Your brain is not going to masculinize or feminize with just more time, right? Between 12 and 18, your brain will not develop in terms of sex or gender. If you're on puberty blockers, it's like putting dough in the oven and not turning on the heat, right? It's not going to change with time. So in some ways it's okay advice, in other ways not so okay advice, right? Watching and waiting would make far more sense than the puberty blockers, because the puberty blockers will potentially sterilize someone. We don't know what all of the health effects are. There's a lot of problems with the puberty blockers. Just watching and waiting, there's no negative part of that. The other side of this would be, in contrast, Dr. So says, when the majority of experts are too afraid to publicly criticize gender affirmation therapies, parents cannot trust that their child is being given a proper diagnosis. That's the other side, and that's the one that worries me the most. Right? It's even the church and the documents that they always point to this idea that we should defer to medical science. Medical experts should help make these determinations. But it seems like they're all being formed in gender ideology, right? So can't even trust the social workers and the psychologists and the medical professionals anymore because they have adopted this gender affirmation model, particularly in medical school, right? People who've been through 20 years ago, maybe less so, but people who are going through medical school now, they're being trained that gender affirmation is the best and really only option, and we should quickly diagnose and treat and go this route, and anyone who disagrees is a transphobe. Which means that parents kind of have to figure this out more on their own because they can't trust that their medical experts are acting with prudence. It's not that they have to be anti-transitioning or anything, but are they listening, right? These are the problems in the last video. It's like, we're not going to listen to the medical expert, we're not going to listen to their doctor, we're not going to listen to their parents, we're not going to ask any questions. If they say they want the surgery or the hormone blockers or whatever they want, we're just going to give it to them. And if anybody disagrees, they're just a transphobe, and we can't deal with them. Right? This is ideology-based medical professions, right? This is not particularly helpful. Another element of this that I think is very important and not spoken of enough is body dysmorphic disorder. It's most commonly presented as eating disorders, right? This is the most common. I brought this up in chapter 8, but I said we will cover it again in chapter 9, and here we are dealing with it. Right? We dealt with body identity dysmorphic disorder, BIID, and that was somebody saying, I feel like I shouldn't have an arm, even though I have a healthy arm, so I cut my arm off. More common, that might be a neurodevelopmental disorder, something like that. Right? It's not a natural thing to want to cut off your leg or to be paralyzed when you're not. But more common is something like BDD, body dysmorphic disorder, and this is perhaps more of a social contagion, or maybe something a bit more less permanent. Less permanent would be a good way of describing it. Right? If somebody feels like they need to be in a wheelchair, this persists for decades, whereas BDD, body dysmorphic disorder, desists, it goes away, right? And it's more of a social issue. The statistics show that about 1.7 to 2.9% of the U.S. population at some point gets BDD. Anorexia is a form of BDD, and it takes the life of 20% of the people who suffer from BDD, right? So if you have anorexia, 20% of people who get anorexia lose their life to it, which sounds really high to me, but various statistical agencies have pointed this out, so I'll believe them on it, but 20% of people lose their life. When we look at the England's healthcare system, right, they really do a better job of statistics than a lot of other countries because of the nationalized healthcare. It's all in one database. It shows BDD is the highest in the 15 to 19 age group. Every subsequent year it goes down. So if you were to look at these two charts here, to my left, you're probably, well, to my right, you're to your left. You can see this one on the left, it goes very low, and then at 11, 12, 13, 14, 15 it peaks, 16 it decreases, and 17 it drops off, right? It disappears very quickly after 17. And on this chart to the right of it, 5, 6, it's still slow. 10 to 14, it goes very high. At 15 it peaks, and 15 to 19 it goes down, 20 to 24, and it just continues to go down. So these two charts, the first one you might remember from the last video, right, part 1. This is on the left, the chart for people being referred to gender clinics for gender dysphoria, right? So gender dysphoria peaks at 15, and then it declines and drops 81% very rapidly. The object to the right is the BDD chart. So here we have BDD, which peaks around 15, and then it drops off pretty rapidly and continues to drop away. I think it would, how do you look at these two charts and not see that there's a similarity, right? To me, it's a quite obvious similarity. A body dysmorphic disorder, it's a real thing. It takes the life of 20% of the people with anorexia, right? This is not an imaginary disorder. It's not an imaginary disease. It's very real, right? And, somebody who looks in the mirror and they see themselves as fat when they're, 90 pounds soaking wet, right? This is a very serious disorder. This is not somebody just craving attention, right? But the way in which we deal with BDD is not to say, you know what, I know in your mind you're fat. You really are fat. We must refer to you socially as a fat person, and we must treat you accordingly as a fat person. Even though you are so dangerously thin you might die, we should still treat you like a fat person because in your mind you are a fat person. We would think that's ridiculous, right? To treat somebody who's 90 pounds soaking wet as a fat person because that's what they feel in their mind, that would be ridiculous. On the same note, we wouldn't say to them, are you an idiot? What's wrong with you? Are you stupid? You're thin. Can't you get that through your thick skull? Right? We wouldn't say that either, right? That's not the approach we take to people with anorexia or eating disorders, is to berate them. We know that they're sick, right? We're all on the same page. It's a sickness. But we listen and we're kind and we work with them on the body image, right? Professionals do this. This means, we take it seriously, but it doesn't mean you can take it seriously without acquiescing to the thing that they're saying, right? A therapist needs to take what they're saying seriously, and it can't, you just don't say you're wrong, right? That's not helpful. But at the same time, you can't agree with it, right? It's objectively not true. They are objectively not fat, and if they continue down this road, it is self-destructive. You can easily see there's a very strong connection between something like this and the gender dysmorphia in youth, particularly late-onset gender dysmorphia, right? Gender dysphoria. It's very different than a 2-year-old who comes out with gender dysphoria. It's something that's arising all of a sudden, right? It's just like with body dysmorphic disorder. Usually it's not an 8-year-old who's anorexic, right? There's not many, even looking at the chart, very few people at the young age are dealing with anorexia. This is a teenage issue more than not, right? It's that 13 to 15 age group, 16 as well, and then it's dropping off. I think this needs far more consideration than it's being given, right? Okay. Another part of this is 1 in 8 males and 1 million males and 8 million females in America suffer from eating disorders. So far more females than males are dealing with BDD. Far more females than males are dealing with gender dysphoria. It also seems to affect females, right? Both of these are dealing with body images, right? That my body does not match how I feel, right? And it's a teenage girl issue overwhelmingly, but not exclusively, right? There's 1 million males who also have BDD as well, right? It's just the proportions. Teenage girls are highly susceptible to body image disorders, with 50% of American female youth claiming that they use unhealthy means of controlling their weight. So this is not rare, right? This is not a rare thing that there's body images and susceptibility to this. Likewise, although very few people probably are truly transgender, that some females might be, or some people might be saying, well, I'm non-binary, or I'm asexual, or I'm pansexual, or I'm something else, right? People are trying to find answers for who they are and what they're dealing with, right? This is a teenage puberty response to the world, right? It's a sense of discovery and figuring out and creating identities that are entirely wrong. And, like the goths and the emos and the hippies and every other generation that's gone through a trend. There's also trends. The only thing is we are medicalizing this to permanent. The emo kids, they had the big gauge earrings, they have giant holes in their ears now. But you can easily, go to a surgeon who can stitch up the giant hole in your ear. Regaining your puberty might not be possible, right? Or your fertility might not be possible. Also, the question is often brought up, if this is a trend, right? If this is a real thing, right? If these rates, these very high rates of gender dysphoria are the natural correct level, right? Say, well, why aren't there all these old people who are transgender? Well, they didn't come out because of X, Y, and Z and all of this, because of their past and all of this. This is true partially for the gay and lesbian thing. There are a lot of people who come out later in life who are married and say, well, I've actually been gay my whole life, and it's a breakdown of the family and all of this. But where are all of the, 80% of this is female. Where are the 80%, where are all of the middle-aged women who are transgender? Where are all the middle-aged women who, are 40, 50, 60, 30, 25 and up? Where are all the women 25 and up who are transgender if this is if this is what it is, right? If this is the natural level, is this rate that's now in the teenage years? And the answer is there's not, right? You don't have all of these older women coming out as transgender. It's a very favorable time right now for transgender people. You could come out as transgender. You're not getting a lot, right? Particularly lesbian, right? Particularly lesbians, more often than not. Are all the older lesbians coming out as men? No, very few, not many at all, right? So the baseline does not seem to be the baseline of the teenagers, right? That seems to be an anomaly, the teenagers. It doesn't seem consistent across, right? Because ideally, younger trans people would be older trans people, just like younger gay and lesbian people become older gay and lesbian people. But this is not the case with the transgender issue. In contrast, and this is a very important part, many middle-aged women, when asked, respond that when they were teenage girls, they felt dysphoric too, right? They felt uncomfortable with their bodies. They felt like they didn't fit in. They felt like it was easier to be a boy than a girl, right? There was a lot of angst in the teenage years that when older women look back, they say, oh, I was a mess as a teenager, right? I didn't know what I wanted, right? And they have all these lived experiences as a teenager, and they say, but I got over it. I outgrew that. These maybe people from my generation, how many of these women said during their teenage years they're bisexual, and then given a few years they marry to a man, and then they have children, and the whole experimental age of the teenage years is in the past, right? And they stop being goths and emos and all of this stuff, and this is natural, right? So if anything, the experience of older women is not that they are secretly transgender. It's that the experience of older women is that when they know that when they were young, they were also dysphoric and they outgrew it, right? That's the prudence and wisdom, right? The phronesis of history, right? Of the older generations. In terms of therapies, what is the best therapeutic approach, assuming, and I am assuming, that there might be some connections between BDD, body dysmorphic disorder, and the transgender issue. Not saying they're the same disorder, but they are similar disorders. There's a similarity there. If they're similar, they may have a similar treatment, right? That's practical, right? Practically speaking, if we're dealing with body image issues, dealing with body image issues might be handled similarly, right? So some of the approaches to BDD would be the therapeutic approach for treating body dysmorphia includes mindful-based cognitive behavior therapies, which teaches people to identify, understand, and change negative thinking patterns and behaviors Patients are taught problem-solving skills during therapy lessons, and they then instructed to practice them on their own time to build positive habits, right? So it's about changing the thinking, right? When we're dealing with anorexia, bulimia, eating disorders, it's about changing the thinking, changing the patterns of thinking, understanding the emotions, and practicing habits of positive body image. That seems quite practical, right? This is quite practical. And does it work? Well, 20% of anorexic people take their own life. It is not guaranteed to work. But acquiescing to the idea that they are overweight also does not work, right? There is no perfect treatment, right? But this treatment is the treatment that we have that works. And the idea of acquiescing is a worse idea, right? For the transgender issue, gender dysphoria, we have discarded this process, which works for BDD. We have discarded it, and we have fully embraced the idea of calling 90-pound women obese, right? That would be like taking this approach, which makes no sense. Therapists also use exposure and response prevention, acceptance and commitment therapies, cognitive therapies, and dialectical behavior therapies combined with medications. Now, some of these medications are, Paxil and antidepressants, antipsychotics, things like Pimozide. If you remember back to chapter 9, the Pimozide, not chapter 9, chapter 7, the Pimozide study that cured a single case of transgender, and they never repeated it, right? The 2 milligrams of Pimozide. Well, what is the Pimozide? It's an uptake inhibitor, a lot like these antidepressants. So the one time when we had a study that used something like these types of medications, if you got the dosage right, it worked. So maybe if the person's depressed, anxious, this, that, and the other thing, and they have gender issues, first deal with the depression and the anxiety and stuff like that. The consequence might be that it also affects the body image issue, right? It helps for BDD. It might help, again, with the transgender issue, right? Because they are similar. There's all these options on the table, but the option we're choosing for gender dysphoria is hormones, hormone blockers, and surgery. If you notice, none of those are on the table for BDD, right? None of those are an option. So it's ironic. So BDD, all these options, and they work. Transgender, we have a completely different set of options that are very invasive, and none of the stuff that we deal with the transgender issue deals with thinking, the way people think at all, right? None of it deals with thinking, which it's an issue of thinking, right? It's, I feel like a man, I feel like a woman. Well, this is all a matter of thinking. It doesn't address the thinking. These therapies address the thinking. Why they're not given more testing is beyond me. And why would you want to go down this behavior changing therapy approach rather than the surgical approach? Why would we want to do that? We'll address that in chapter 10, but in short, there are a lot of side effects of hormone blockers and opposite sex hormones, right? From heart disease to cancer to not fixing the underlying thinking that's causing the problem, depression and anxiety, suicide, right? You have all of these underlying issues, including these things shorten the life by quite a number of years because of the side effects of the medical approach. You've got to take hormones daily or weekly for the rest of your life. Wouldn't it be better to treat the psychological element of this, right? Wouldn't it be easier to change the thinking than it would be to change the body, which can't ultimately be changed, right? Next section is we're dealing with a society, and particularly the youth, that's dealing with generalized dysphoria. This is another part of it, to say, well, look at all the gender dysphoric youth. It's true, they are gender dysphoric youth, but we live in a dysphoric society. The idea that the youth are dealing with gender dysphoria is not shocking to me. The youth are dealing with gender dysphoria, life dysphoria, existential dysphoria, school dysphoria, gun dysphoria, climate change dysphoria, right? Everything in our world is dealing with dysphoria. In addition, body image, especially for women, is extremely negative. You go to the grocery store, you got naked women wearing bikinis on the cover, people gossiping about this person got old and look at how terrible they look, and look at this person, how they gained so much weight and how terrible they look, and this one got a divorce, and this one's, right? Everything is negative, and a lot of it's critical of body image, particularly of women, right? To be a young girl would be dysmorphic, right? To be dysphoric, I mean, right? There's just, the dysphoria is thorough within our culture, right? And part of it is the removal of religion and faith from our lives, right? It's hard to look in the mirror and to see the image and likeness of God and to be dysphoric. If you look in the mirror and you see a beloved child of God, you find joy and peace and mercy for yourself and for others, right? If you have encountered and you abide in God, you are living, you are in the enjoyment of God in himself. You are experiencing charity, which with charity comes joy, peace, mercy, right? These are the elements that come with abiding in God. If you're in this chaotic thing, and even if you are nominally Christian or Catholic, it's not going to do anything for you. You need to abide, right? You need to be abiding in God, right? We receive and become Christ, right? It's in the transformative nature of our faith that there's peace, right? It's not in the nominal possession of faith or in the agnosticism of faith or non-faith, right? This is not going to be a solution. Dr. Robert Leahy points out in a psychological journal, the average high school kid today, this is in 2008, has the same level of anxiety as the average psychiatric patient in the 1950s, in the early 1950s. The average person, teenager, is more mentally ill, is more anxious than psych patients were 60 years prior. Dysphoria, this Rachel Ann Williams, who's transgender activist, she points out dysphoria is a symptom of modern society. It's just we are all dysphoric. A study in 2021 found that 28,000 out of 28,000 surveys, 60% of millennials are making over $100,000 per year and still believe that they are living paycheck to paycheck. We are living in a time of tremendous prosperity, peace, political peace. Right? We should be flourishing. Right? In no time in history have you ever had people with the standards of living we have today. The consequence of our high standards of living is that we are miserable and delusional. Right? Even the richest people on the planet feel as if they are poor and they are insecure because they're not living according to their means and they're not living according to reality, and they're not realizing the limited nature of the human condition. Right? You live to 110 and you die too young. Right? You have all the money you need and you're too poor. Right? You have all the health you need and you're too sick. Right? We are sick in the mind. We are people who are dysphoric in the mind because we have a very unrealistic perception of the world. Well, the Human Rights Campaign did the largest of its kind survey ever with over 12,000 participants. It was done with the University of Connecticut. Sadly, University of Connecticut has buried the study. They've handed it entirely over the Human Rights Campaign, who will not show the data, right? Usually when you do a scientific study, you have a couple pages, right, of a study. You include data, a certain amount of raw data. They have included no data. They have included only infographics. I've written to University of Connecticut saying, can I get your study, right? Can I see the results of your study? And they responded, no. I said, but I was a doctoral student. Can I just look at what the Human Rights Campaign has, which is infographics, and which is sad. That you don't want to show the truth of your study. But anyway, but there's still gems hidden throughout this study amidst the infographics. Some of it is that LGBT youth are 85% consider themselves very highly stressed, right? Highly stressed out people. But when we look at this chart below, and I've changed it to avoid copyright, but it's the same data, 79% of boys, right? And because of this study, they would probably be gay or bisexual boys, right? 79% of boys claim to be stressed. 86% of girls, right? Born girls are girls, stressed, right? So girls have 7% higher stress than boys. And when you have 12,000 participants, it's a pretty accurate results with standard deviation. If you look at people who are born female and became male, 90% stress, right? The stress has gone up. Born male, became female, stress has gone up. Interesting, though, when you look at this, and this is not what they intended by the study. Hopefully this is clear what I'm trying to say. I've never been able to say it perfectly clear. Those who were born female are more like those who are born female who claim that they're male are most like females. Those who are born male and say they're female, their stress levels are more like males. Look at the connection. Boys have lower stress than girls. If we were to take this second part seriously, then the transgender youth, we would have to say females who became males have the highest stress level. Females who became males. So a female who's normally higher stressed becomes male, and their stress goes up. You would think if a female became like a male, their stress level would be more like a male. Instead, it's gone up to the highest. When a male becomes a female, you would think the stress level would go up. But it hasn't even gone up as high as cis women, right? Natal-born women who claim to be women, right? If we look at the comparison, transgender people born girls who say they're transgender, their stress level goes up relative to the boys, right? Again, I can't really say this clearly, but if you say being transgender increases your stress level by 5%, well then a boy who becomes a girl should be 5% more stressed, and a girl who becomes a boy should be 5% more stressed. This is not the case, right? This is not the case. They're going up relative to their natal sex. So a boy who becomes a girl is very similar to boy who becomes a girl is more similar to being a boy. A girl who becomes a boy is more similar to being a girl. And rationally speaking, if a girl becomes a boy, is that very stressful when a girl becomes a boy? What does it mean when a girl becomes a boy in teenage years? Wearing jeans and a t-shirt, short hair, no makeup? It's not that stressful, right? A lot of cis natal-born girls do that anyway who aren't transgender. When a boy, teenage boy, becomes a girl, how does it change? Wearing dresses, wearing pink, piercing the ears, getting long hair, makeup, maybe stuffing a bra. Who do you think this is harder for? Girls who become boys or boys who become girls? Very clearly, a boy who becomes girl is going to be far more criticized than a girl who becomes a boy. Without a doubt. Effeminate males are bullied. Masculine females, they're not bullied. They are the bullies. Right? The idea that it is significantly easier, if you look at this, females who become males have a 90% stress level versus males who become females have an 85% stress level. That females who become males are 5% more stressed than boys who become girls is clearly illogical, unless girls are automatically more stressed than boys. They continue just to be stressed girls, right? By being transgender, female who identifies as transgender, you are more stressed as a girl, and a boy who becomes a girl becomes a more stressed boy, right? Hopefully that's clear. Also very high, non-binary and non-conforming and different identities. And the highest one is non-conforming, gender non-conforming and non-binary, meaning the less you fit into a binary system, the less you are happy, the less ease you have. So isn't the whole point of coming out and identifying a certain way to liberate yourself to some degree of this? You would think, oh, I'm not going to conform to anything, I'm just going to be myself. You would think that would be less stressful. You wouldn't be at 91% stress level, right? You would be at ease, right? It is not. So I think the further you go down these ideologies, the further you get from nature, the more stressed you're going to get. Now, they don't test any heterosexual males and females, right? They're not on there. It's all LGBT something, right? So you would assume the least stressed heterosexual males, then maybe heterosexual females or gay males, because they're still males, so they have lower stress. And then females and homosexual females, and then transgender males and females, and then non-conforming. But the further you're moving from the heterosexual point, the more stressed you're getting, the more stressed you're becoming. And this is kind of an accidental conclusion of the human rights campaign. In the last slide here, Johanna Olson-Kennedy, who I talk about quite a bit, who I disagree with quite a bit, she, in this study, well, not in study, in this action, it's a study that's also a medical procedure. And she's at UCLA Gender Clinic. She did this thing where they were removing the breast of gender dysphoric youth as young as 12 years old. Before that, even in some of the 12-year-olds, they don't qualify because they didn't have enough breast tissue to have their breasts removed, and hormone blockers and all of this. She says, the most common dysphoria was the claim, I worry that people are looking at my chest, 57%. I avoid going to the beach or swimming in public places because of my chest, 41%. I avoid using the locker room because of my chest, 53%. These are transgender, female to male youth, right? 12-year-olds, 10-year-olds, 11, 13, 15, up to 15 or so. All minors. The idea that a girl going through puberty is going to be self-conscious about developing breast is about as common sense of a thing to say as possible, right? Do you think there's any teenage girl who's going through puberty who is not sensitive about developing breasts? It's like any male is going to be sensitive about growing hair in his armpit and on his genitals. It is natural to be uncomfortable during puberty. Anyone who thinks that you just develop breasts in the Western society where men are oogling after you, and it's not going to have any type of psychological effect on you. You're just going to be completely indifferent to your body, going from a child to a fully developed woman, and there's not going to be any discomfort or stress or worry in there. What a ridiculous thing to even examine, and to use this as evidence that the child is transgender is even more insane, really. That a 12-year-old that's developing breasts would say, "Oh, I worry that people are looking at my chest." That only 57% would say they feel that way is, to me, a lie. I would think 100% of teenage girls feel that way. 100% of teenage girls feel uncomfortable in a bathing suit or in a pool, and 53% of teenage girls avoiding the locker rooms. Having gone through high schools, boys have to change all in one giant room. Girls have their own individual stalls, and they still feel uncomfortable getting changed in these stalls, even though they have complete privacy. The idea that they would feel comfortable in an open space like this in their teenage years would be, it's just so strange. I looked at this article from Marianne Clark about older women who reflected on their time in locker rooms. Most women, cis women, right, natal-born women, heterosexual women, say, "I'm never very comfortable in a changing room sharing that much of myself with strangers," right? I don't know any woman who likes being naked in a locker room. Now, guys walk around in some locker rooms, they're in the morning putting on their Preparation H in the mirror, naked in front of 10 other guys, trying to show off how unembarrassed they are being naked. Men do stupid things like this, especially middle-aged men, right? In YMCA locker rooms, they do stupid things like. Women do not like being like this, right? And there's probably a deep psychological reasoning behind this, because women are vulnerable to rape. Women are vulnerable, if they get raped, for childbearing. Women need to protect themselves, right? There's a greater sense of modesty with women than for men in terms of their body and their sexuality. So this, again, back to the idea of Johanna Olson-Kennedy, to remove a 12-year-old, 13-year-old's breasts because they say they feel uncomfortable in the locker room. What a ridiculous thing, right? If that's the standard. And again, her response to this was, well, what if you made a mistake? It's, well, if they get, when they're older, if they want to have breasts, they can just get them back, right? They can get breast enhancement. The idea that the body is just pure datum, right? It's just pure materiality for us to manipulate and to mold into our own individual identities is just part of this modernist Enlightenment narrative, right? From a Catholic Thomistic perspective, we have a teleology, we have a form, we have an efficient cause, we have the material cause. We have all of these different ways of looking at it. It's not this. It's just not this materialist approach. Okay, well, this is it. This is all I have for late onset gender dysphoria. Next, we move on to the crescendo, which is how do we properly address these issues in adults, which I think is very interesting. Okay, have a great night.